So as I mentioned in a previous video, in May, the FDA Endocrinologic and Metabolic Drug Advisory Committee had recommended against the approval of Icodec, the once-weekly long-acting insulin, for the treatment of type 1 diabetes. They felt that the risk of hypoglycemia did not outweigh the potential benefits. And although the FDA does not always go along with what the advisory committee recommends, this time they did. So they have not approved the use of Icodec in the United States. Now, the advisory committee did not talk about type 2 diabetes, and in these studies, there was an improved time in range for people who are using Icodec versus daily glargine. The FDA is asking Novo Nordisk to provide more information on the manufacturing process, as well as more information on its use in patients who have type 1 diabetes. So what's my opinion? I think that Icodec is an option for people who need long-acting insulin. I don't think that it's the ideal treatment for people who need both long and short-acting insulin. I think the ideal management is still what we currently have is the hybrid closed-loop pump and CGM combination, and hopefully one day a completely closed-loop system. For patients who have type 2 diabetes who only need long-acting insulin, I think that Icodec is an option for them. For patients who have type 1 diabetes, I think Icodec could still be used to prevent DKA, maybe even in combination with pump therapy at a lower dose, because pumps sometimes fail. So if patients are not getting their basal insulin for several hours, not knowing that the pump's not working, having some long-acting insulin in the background may help prevent DKA. So I think that this requires further study and further research. I do hope that it gets approved. I don't think that it's appropriate for everybody, but I do think that certain patients would benefit from it.